Hello everybody, my name is Arianna Galindo and I'm a student at Tilleright High School. This summer I did public health, an internship in public health at the Rodham Institute in Washington, D.C. So a little bit about the Rodham Institute. It was established in 2012 by Dr. Gigi Albayumi as a means to help with the problem of health inequality and inequity in Washington, D.C., which surprisingly is a really huge problem, which you would think that the nation's capital has it all figured out, but no.
But no.
On my first day in Washington, D.C., like the day after I got there, I had a dinner with my mentors, and there I was introduced to the entire team, which was these four amazing ladies here, and three of which I worked really closely all throughout my internship, who sort of became like my second family. And here are their names and Christina's husband, Adrian. A big part of my internship was shadowing Dr. Gigi at her work. She's an internal medicine doctor in MedStar Hospital in Washington, D.C. So every week I would go into her workplace, and due to HIPAA, I couldn't take many pictures, but I was working with three aspiring medical students, and I got to meet really cool people that Dr. Gigi had as patients. Some other people that I worked with, the internship that I did gave me a lot of freedom in meeting people from very different areas of the healthcare system. This right here is a medical student at Georgetown University that I was staying in at my first housing situation, and she and I became besties, and I love her so much. This right here is a retired cardiology doctor and current professor at George Washington University, who was providing free blood pressure screenings at the health fairs that we were attending, my mentor Christina and I, because we were doing a lot of community outreach work. This over here were the people that I was mostly working with at Dr. Gigi's workplace, and this right here was another prospective medical student from Africa. So like I mentioned before, my first housing situation was with a medical student, and it was actually with three other medical students at Georgetown University. And thank you to Sarah for taking these pictures, because I did not take pictures of where I was staying. This first house was at the Georgetown University whereabouts, which was a really safe area. And then my second housing situation, since my internship got extended for 1 week, was at Howard University dorms, which gave me the opportunity to get to know a little bit more about the university, talk to some students there, and just overall get a bigger sense of what Washington, D.C. was about. Also, something that I did in my internship that I just ran out of things to do was review the Rodham Institute website before it's launching. And I actually redesigned the logo. Not really redesigned it, but while reviewing the website, I realized that they didn't have a clear, marketable picture of their logo. So I kind of did that by myself, because getting that done professionally would have cost them hundreds of dollars. During my free time, which was a lot of time, even though I was asking for whatever I could do more for the Rodham Institute, I spent a lot of time in the DC Free Museum, so the Museum of Natural History, the Smithsonian Museum, and things like that. I also was invited by my mentor Christina's husband to go to his workplace, which was at a hospital. So there I got to talk to nurses and other medical staff and just get to know more of those aspects of the medical field. And I also got to tour a bunch of universities, so the George Washington University, Georgetown, Howard, and Gallaudet. Something that surprised me was Dr. Gigi's physician-patient dynamics. So every single day that I went there, we had 3 to 4 people that we would see, and I would talk to them, take notes, and then talk to Dr. Gigi about what they had told me. And sometimes we would get released early because one patient couldn't make it. And I found out that Dr. Gigi is one of the very special physicians who takes like 30 minutes with each patient, when the average is like 5 minutes per patient, which was insane because the amount of work and information that we were getting from these patients was not like, I could not imagine getting that from them in just 5 minutes. So it was really cool to work with a doctor that cares so much about her patients. My advice for future interns is to just advocate for yourself. My internship really pushed me to kind of get out of my comfort zone. I had to do a lot of talking to people, talking to strangers, starting conversations, which helped me. And I also work with Sarah. She is here to help you. Everybody's here to help you. You just need to ask, and they will meet you halfway, but you also have to meet them halfway too. Do extensive research on possible internships and keep your mind open, because I had like 6 or 7 internships that I was interested in, and it just, Sarah kept saying like, oh no, this one's not available anymore, this one's not available anymore, until we found this one that was like perfect for my interests and needs. So just keep your mind open and don't close yourself off. And remember to be grateful and communicate, like be grateful for everything. This was such an amazing experience. And thank you to all these people.
Thank you. Awesome.